All right, so we're bringing you a special coverage in the run-up to President Cyril Ramaphosa's address. We'll bring that to you live, expected at 8 o'clock tonight, on government's response to the pandemic. And of course, the context here is the new Delta variant now predominant, now driving new infections in the third wave, especially in Gauteng. That was confirmed by scientists yesterday. Let's look at what's expected again. We're joined by political editor Mzwandile Mbeje. Hi again, Mzwai. So gatherings, possibly a target here, alcohol sales, just outline what the main expectations are.
Good evening again to you, Francis. If the intention is to arrest the spread, certainly the issue of gatherings comes into the spotlight. I think one of the people who were being interviewed by the SABC basically was saying the best way to defeat this is to limit the movement, because the virus doesn't move. It's us who move the virus. So clearly, the measures that are in place, Francis, right now are not sufficient. Remember, a couple of weeks ago, the president announced that the country was moving to level 3. But since then, the numbers have simply shot up. So you can't then simply sit and say, well, I did something last time. And with the knowledge that we have now, that it's actually the Delta variant that is driving this third wave. So it's of great concern. I mean, we spoke about what the pictures and the images came out of India a couple of weeks ago when this variant was detected. So clearly, the issue of gatherings, the issue of alcohol. In fact, when it comes to alcohol, Francis, I think there needs to be a bit of context to this, because some people simply think the president will just target alcohol and just stop alcohol. But this is what happens. Right now, the hospitals, particularly here in Gauteng, are overwhelmed. Now that the hospitals are overwhelmed, so there is a shortage of beds. So people who need beds, who are critical, don't find beds. Why? Because there are a number of trauma cases. When you look at some of what causes some of those cases, is perhaps the accidents, which, yes, an accident is an accident, but some of them you could see they happened because either people were having fun and the stabbings, you know, all those kinds of things. And you can't not attend to those people. You have to attend to them. And then those who come critically ill, they would find that the beds are not there. Even if someone was to survive, Francis, it's very difficult. So that's why they would look at the issue of limiting the issue of alcohol. And of course, I think, yes, we've been told that the schools are a bit safer. But remember, the kids go to other kids and go back to their parents. Perhaps you may see schools perhaps closing earlier. They're supposed to close, I think, public schools on the 9th of July. Perhaps that issue could also come in to Allow the vaccination program that has been rolled out of the teachers, perhaps to quicken quite fast, Francis.
Mzwai, what else should he address tonight? Last time, commentators were saying the elephant in the room was the charges that the health minister faced at the time, and the president didn't really discuss those. Perhaps now the issue on the minds of many South Africans is vaccinations. We wanted to achieve herd immunity this year, and the rollout is so slow in relation to many other African countries. Do you think we really need to start getting a clear explanation now as to why?
Actually, the address tonight, Francis, needs to tell us, so what are the plans to really quicken this rollout in terms of vaccination? Because we have seen in countries that are far ahead in terms of vaccination. In fact, I'll mention Israel. They were complaining. I mean, Israel is one of the countries that I think it's one of the top countries in terms of rolling out the vaccination. But they are seeing a new surge in cases. So as we delay to vaccinate the whole population, new variants take effect. So by the time you get a grip or a grasp on what to do, already you have to battle with new variants. So what if those doses that we have don't work in those if those new variants come up. So it's important that the country gets vaccinated as soon as possible, and the president lays out a plan. How are we going to do it? So how fast are we going to do it so that the community really, or the population, is able to reach some sort of herd immunity? So in the event those other variants come, so somehow the country is protected. I think what people want now, no one wants the economy to shut, because you shut the economy, you're still killing the people, because livelihoods lead to lives. The president and government need to be able to explain, where are we? How far are we going to go? So what is the target? Once we are able to do that, at least half the job will be done, Francis.
Yeah, at least the experts yesterday saying that the research from other countries already suggests the vaccines we are using do provide coverage against the Delta variant. That was SABC News' political editor Mzwandile Mbeje.